Okay. So sorry, this network has not been. Hello. Um, no, no. Hello. Okay. We should be good now. I want to know if we are able to see me.
Yes, I can see you.
Okay, good. I'm so sorry.
Wait,
The
whose
network is
network?
really.
I don't even
Yeah.
know if it's our network or your network.
Honestly, I don't know. Because it's already working well. Then the next 2 minutes, I'll just feel like it's not showing again what's happening.
The
I'm
devil
trying
is a
to
liar. Oh.
I'm trying to hang on. I think okay now.
Hey, God, I beg.
Nigeria network everywhere. Hear the word of the Lord. Don't stress me, please. Okay, I just want to ensure that she is able to join. I'm trying to copy the link and send to her. I've invited her already, but I don't know. Even up until now, I'm unable to see the two of you. I just know you guys are talking. Hi. Okay. No, so there me. Hello. Oh, good. Yeah, sorry, it's the network.
Okay, I can hear you.
Okay, you can hear me. I'm just trying to see that
Yes.
Mr. Adepuke is able to join. But while we are doing that, can I say you should also introduce yourself in one
Okay.
word? Yes, to our
One
viewers
word.
at home. In few sentences.
Okay, my
Okay.
name is Adewi Tolulokpe Rosaline, and I'm a registered pediatric nurse. And I find pleasure actually relating with children. And it's my ultimate goal to see that children actually are in wellness and wholeness. Even when they are sick, they recover. That's just the joy of it. Even when they are
Yes.
sick, the joy is that to see them going home and coming back and say, Auntie Nurse, just see you, baby in you, even when you cannot even recognize them.
Done
So I
again.
think so
Yes,
I think
yes.
that's just it. That's just it.
Yes. Yeah, that's it. Honestly, like what you said, even when you cannot recognize them again, their parents still recognizes the face of that nurse and take care
Yes.
of their children, and that's his passion. Thank you so much. I'm
You're
still trying to
welcome, man.
add our second guest. But before then, I'd like to say hi to all of our viewers at home. Thank you for joining. I can see us all a big blessing. Thank you for joining, Ma. Good afternoon. And while we expect our second guest to join us, our topic this afternoon will be talking about tiny lives and the big myths surrounding their care. A lot of times, people have different mindsets, different beliefs about newborn. The moment you have babies, you have a lot of advice coming from left, right, and center. Do this. This is what you should do. This is what you should not do. And another person is also saying another thing. And we realize that oftentimes mothers feel confused. They don't know what to do. They don't really have the right information or how to take care of their children. And I'm so glad today because we'll be discussing some of these things and ways we can deal with them. So, just like I've introduced earlier before the network logged me out, that we have two nurses in our midst. I'm still trying to add our second guest. I don't know why she's been unable to join. I feel maybe network probably from my end too is an issue. If she's online, please, Mommy Adekoke, you can send me an invite because I'm unable to copy this link to send to her. I don't know if you can copy this link. I just put it, send it to me. Okay. So first, we need to understand what meets her, what her meets, what do people see it her. I will speak from my own perspective. Like myths are just like false belief, things people think are true, but they are not. things probably one or two people have come together to say, oh, this is why this is this. But if you look at it scientifically or even from the point of view, yes, yes, we can send it here so anybody can join. Okay, trying to like, I'm even unable to copy that link from my end. So, and if
And
I
should I
should
send it to
log
you on
out,
WhatsApp?
if you do that,
Can
yes.
you minimize?
I doubt that because I tried doing that earlier. I think it was just logging me off.
Oh,
Yes, I'm thinking if she's online, I'll just have appreciated that she would have sent me an invite and then I can add her to the call. Because I've invited her, but it's like maybe she has logged
maybe
out.
she's not
Yeah.
online.
Okay. And like I was saying, a lot of times people say different things that get confusing about the care of children, and that is why we've come up with this topic, because realize that some of these beliefs, some of these false practices lead to the deaths and different illnesses in children. And oftentimes you realize that some of these children don't even come out of it. Like, they eventually might continue to live with it for life, probably due to the negligence of the carers, the parents, or even people in the community. I was listening to somebody saying she told a church member not to give her baby water, and then the person eventually went ahead to give this newborn water to drink. That is somebody in the community, not even the carer now, not even the parent. Okay, mommy is here. Mommy, I go. Okay, okay, good. I think I'll be adding you now. She should be able to join us soon. I would like to know when you are in, ma. So it means that it is not just for carers, it is not just for mothers, it's not just for the family, but for the public at large. Everyone needs to be well educated about the care of their children. I don't know if she's in. I sent another invite. I don't know why. Have you been able to join, ma?
She has not joined. She has not joined.
I sent her another invite. Let's see what's happening. Maybe it's network from my end. I think it keeps saying connection failed. I think it's network from my end. Okay, while we wait for her, she should be able to join now.
She said
I'm
she cannot
telling
join.
why.
She should send a request to you
She
then.
has sent a request and I've accepted it, and like that, I don't know.
Maybe it's network.
I feel it's network because from my end, it's showing that she has joined with you.
But me, I can't see her.
It's just telling me adding. The same process.
Maybe she
Okay,
should
ma.
go
I
off
know you
and
can
come
hear
back.
us, but maybe
She
if you
should
go
log out.
offline, ma, and maybe
Ehen.
relog in, then you
Exactly.
can send a request again. I should be able to add you. Because for my hand, they're saying she's added to the call.
She's not added to the call yet. Can you see me now?
No, I still cannot see any of the things. But at least
We
I
are
can hear you and I'm
invisible.
hearing you clearly. So I think I'm
Okay.
fine with that. I will eventually look at the rewatch replay and then we can. I don't know why I still cannot add her. Her invite is there again and then it says it's still trying to add her. Okay, I'm just trying. I'll just give a few more minutes and see if she's able to join. Mommy, let me know when you've joined, ma. Because from my end, it's showing that she can join, and I really don't know why she's unable to. Can't even share the broadcast to her. It shows she's invited already. Okay, while we do
Please
that, while we wait
continue.
for her, yes, I'll continue. Okay, so Nasodayemi, while we have you on ground, I'd like to say that from your experience being a pediatric nurse, what is your own view about meat in child health care, and what are the experiences, probably few experiences you've had regarding this?
Um, the myths, there are so many myths that I've experienced in pediatric nursing actually, and it's just when I hear them, I'm just really surprised that in this century, like those things still exist.
Mm-hmm.
Because I didn't believe that it still exists, and I didn't even know it still exists until when I started working with state governments. That was when, let me just say, it was an eye opener to me. And one of the myths that is still existing is people still believe that when they drink pawpaw water, it will prevent
Mm.
jaundice in their child, or when they
Mm-hmm.
put their child in under the sunlight. Because they even argue within the hospital that our forefathers, our mothers, that's how they took care of the husband or the wife, and nothing happened. So what we are saying is not scientifically proven that they should not give pawpaw water. That's number one. Another thing again that I still encountered, I think that was recently, was a mother was trying to tell us that we should help her mold her baby's head.
Head.
The
Wow.
baby that was sick, that instead of her to be saying that the baby should get well, what was on her mind was that Ejeba me Maori or mommy help me mold my
My baby's
baby's
head.
head. And I'm like, wow, molding baby's head in this era, is that even what you're meant to be talking about? That's two. Another myth that people still believe is the one about breastfeeding. Some people believe that children should still take water, that they are tasty, that they should still take water. So, but they don't know that even breast milk, 90% of breast milk is
Mm-hmm.
water. So a baby does not actually need water. And let me just say another one too. The one that is very funny was that a child was having seizure, convulsion, and the relatives were like, because the mother drank cold water during pregnancy.
Whoa, wow. How does that relate?
I don't
What's the
know.
relationship?
That's why the baby is having seizures. I think so. Those are one of those are one of the things that I've really experienced, and I can call them myths in pediatric nursing actually.
Yeah, I can see a comment coming in while you were talking, and this person, Bagbwe Roda, she was like, the papa water is very rampant this time around. Wow, that's nice. That's good to hear. And so for people hearing us at home, yes, I don't know why Mummy Adegoke can't join, but like she's saying here, she can hear us well. She's been invited. I'm unable to invite her any
Later,
longer.
have she
I keep,
invited you to?
yeah, I keep adding her, and she's showing here that she's been added. But
But she's not been added yet.
yeah,
Maybe
okay,
it's our
thank
network.
you. Yeah, maybe. Honestly, I don't know.
Mommy, on and off your data.
I know she can hear that. Maybe she can try that again and see, because we were successful at the first instance.
Exactly.
I don't know why. I really want to hear her voice and have her own input in this webinar today anyway. But network can do. Okay, so thank you for that little intro. We've heard a lot. We've seen a lot as nurses in the care of children. And sometimes this affects children for life. Even some mothers regret that they took some of this action while their children were growing up. One of the reasons that inspired me to come up with this webinar was few of my write-up in previous week. I wrote about just a funny write-up. I was just writing about justice for newborn, and I was talking about things mothers, the public, and people should not do. And a particular post stirred up a lot of conversations, and in fact I was like, really, do we still have people do this? And that was the post where I talked about children having big breast, and having breast
Mm-hmm.
milk in it, the milk that is called the wheat
Yeah.
milk. And you hear people say, I still had a child recently, my child still had a big breast, and then I used, warm
Hot
clothes,
water.
warm water, hot water, and I'm still like, oh my god, do you know what this can cause a child? I remember back
Mm-hmm.
then I had an admission that had this particular neonatal masters, and the mother used hot stone. The question I ask myself a lot of time is, if you as an adult, can you do that to yourself? If you can do that to yourself, that won't be an issue. But sometimes we should think about some of these things we do to this newborn. The question is, can I do it to myself? Will I be comfortable doing that to my own self? And okay, I think. Oh, good job. I think she should be able to join now, because
Okay.
I've tried adding again. I saw an invite
Thank
on my.
God. Joining at last.
Mama, they go, okay, you're welcome, ma.
The
Thank
devil
God,
is a
though. I
liar.
kept seeing the location. Maybe I'll be able to join.
The devil
Thank
is a
you.
liar.
I switch off and on. It's well.
Thank you for
Been enjoying the
joining, ma.
discussion. Oh,
Ma?
I've been enjoying the discussion. So
Thank you, ma. So now, and when the child came to the hospital, we realized the breast, number one, was so hard. Secondly, the breast is now very black due to the hot stone. You usually feel like, as an adult, even if hot stuff fall on us, we shout, we cry sef sometimes, even as an adult, when we face some of these things. So how would you allow a child to go through that? And I heard a lot. Imagine a woman coming up to say, my child is not feeling fine, and because I'm pregnant, and the next thing people start advising is, stop breastfeeding.
Stop breastfeeding.
I'm like,
Yes.
what's the relationship? That's why I decided to say, oh, it is me that have been talking. I feel like, let other nurses, other specialists come up to say things about this. Maybe if we have enough healthcare sessions, I mean, health tutorials, health education on these
yeah.
things, maybe there will be reduction in the rate of mortality and morbidity rate among our newborns, and also the rate of mortality in children will reduce. I've seen a mother cause a deep brain damage to her son because of just one singular act. The baby had jaundice. They wanted to admit in the hospital. This woman said, no way. I know what to do when I get home. I'm going to give purple water. This same purple water. And I'm like, you are back to this purple water era
Thank
again.
God for Popo.
Thank God for purple. And that eventually caused a brain damage to the child. The child is never normal till date. And what's the essence of a child, a glorious child that cannot live the life other people are living? Will you say it is your own negligence as a mother, or you say the negligence of people around that caused that? Because we have young people getting married these days that they really cannot take care of their children themselves. It is their grandma that, mom will do this for me, dad will do this for me, and grandmothers will do things at their own will. But if we as mothers, carers, can know what is expected, I think it will allow the health education to go round, and then it will reduce mortality and morbidity rates. And that's why we are coming up with this webinar today. So I'd like to welcome our guests once again. Thank you for joining after all the network brouhaha wala. Thank you so much. So over to our pediatric nurse here, Nurse Odeyemi. I'd like to ask you some few questions about what you've seen, and majorly, what do you have to tell us about neonatal care first? What is neonatal care? What is child care in your context as a pediatric nurse? And do you feel the kind of care you give to a child at delivery, I mean at the very point of delivery, can affect that child for life?
That question is very deep. But I would like to say neonatal care is a care that is very delicate.
Mm.
Let me just put it, let me use the word delicate, because
Yeah.
a child is growing, and there's going to be development. So and there's a saying that when the foundation is faulty, what can the righteous do? So we must
Yeah.
actually care for that child from the foundation level. So what we do at the foundation, we affect the aftermath of the child. And you're talking about delivery, yes. Because you notice that sometimes when delivery are being taken wrongly, like okay, they go to all these
Hmm.
hospitals or anything, and something goes wrong to the child.
Mm-hmm.
That's when they'll be saying the child has cerebral palsy, or the child has
Mm-hmm.
respiratory distress or anything. That is why the delivery of a child is very essential. It is very important and key, because any mistake that is being taken at that point, then the child might not come off from such things. So
Use for life.
neonatal care, it is a very delicate care given to children.
Okay.
So
Thank
that's
you
what I
so
have
much
to
for
say.
that. Yes, ma. Over to mommy Adegoke. She being a midwife, I know that she has seen a lot. And mommy, I'll be throwing this to you. As a midwife, do you think that the way we take care of pregnancy can affect a newborn and even children as they grow?
Yeah, thank you very much. Hope you can hear me from here.
Yes,
Yes,
we can
ma.
hear you.
Our viewers at home, we want to know if you can hear us. You can put it in the comment section. Thank you.
I can hear you both, too, but I can't see you. So we
Same
are
here. I
good.
can't even see both of you.
We can hear you.
But I can see
That's,
the three of you.
yeah. Yeah, so back to your question. When we talk about having a well baby, I always say this: the quality of the baby is better than the quantity.
Hmm.
We have several babies out there. People will say, congratulations, hey, I have a baby boy, baby girl. Meanwhile, the quality is so low. So we are not after the quantity alone. We are not after well baby, well mother, live baby, live mother alone. We are also after healthy baby and healthy mother. So the quality means a whole lot to us. It's not about karikiru, irupo, sapapo, red. We want live and healthy ones. So in that sense, to achieve that, you don't achieve that on the day of delivery. As a matter of fact, you achieve that right from pregnancy. Talking about elder living of the mother, talking about hygienic practices, and a number of things. The awareness of the mother. For instance, a mother with HIV, HIV virus in her system that is not taking proper medication,
Yeah.
not going to for antenatal clinic, not being compliant with her medications. What do you expect to have? You know that the rate at which the baby can get contracted is so high.
Yes,
So
ma'am.
at the end of the day, what do we have to show for it? A mother with hepatitis B virus that is negligent about necessary medical interventions. What do you expect? So it starts from when the woman is pregnant. As a matter of fact, even when the woman is pregnant, because what the woman, her lifestyle, her healthy living, her diet, and all determines the awareness of the baby right from the first trimester. So that's even where it starts from. If you actually want to have a healthy baby at the end of the whole journey.
Thank you, mommy, for that. And I'll still bring you back to that. You said something that even the kind of food we eat to ensure healthy pregnancy. So people come up with this myth or this myth that we should not eat okra, we should not eat snail, pregnant mom should not eat some particular food in pregnancy. What do you have to say to this as a midwife?
Thank you very much. In fact, we have several of these. In my clinic, is a topic on its own. Myths in pregnancy. We talk about myths of lifestyle. We talk about myths of your diet. And it's a whole lot when we talk about this myth in diet, because it is really costing pregnant women their wellness. Some women have low level, the PCB, we keep battling with it simply because they are not healthy, eating healthily. So there are several ones they mention. They mention okra. If you take okra, your baby will be salivating. If you
We
take
don't.
kidney snail, your baby will be crawling on the chest. If you take this, orishirishi, they will tell your baby, if you take banana, your baby will have all cowrie. I always say them, inyori, fufori, amalauri, and lots.
Wow.
There are several practices that are harmful to them when it comes to the health, the feeding aspect. And we've got to be intentional in making our women understand, in creating that awareness, to letting them know that no, I always say that whatever food you eat that doesn't go well with your system is a taboo to you. It's a do not touch for you. So if you eat something and it upsets your system, you know that whatever you eat is also food, you always have serious problem. Good. That is what you have stayed from. So there are some food or food stuff that you on fruits you may need to abstain from in first trimester. After first trimester, good. You then begin, okay, what works well for you. Because when it comes to even eating elderly, it cannot be generalized. We have individual differences when it comes to our health issues. When it comes to pregnant women management, no two pregnant women are the same.
No two pregnancies are the same.
No. So you don't. I always say that you don't do copy. Don't copy another person. No. What works well for you may not work well for another person. So that is why their care can be individualistic. Something that will be peculiar to a particular pregnant women. But there are the few general ones we talk about, but not like okra. With all the essential elements in okra, feel free to take your okra. Every child can salivate, especially when it comes to their teething period, when they have increased salivation and all. So it's not about you taking okra. Take your okra readily. I always tell them, do not take it in the presence of those that will talk.
That's important.
You want to eat a banana, you now carry your banana, you carry your okra, you go to the front of the house, you start eating there. You are the one causing yourself any unnecessary headache. In your bedroom, take your food elderly. And that is what we keep teaching and preaching. So that at the end of the day, the woman will have necessary nourishment. I always say that if you take all the Martiniques in this whole world and you are not putting elderly in line with it cannot work. So there's no magic in this.
So it means that we need to eat well to have a healthy pregnancy and also a healthy baby.
Yes, please.
Thank you so much for that. I'd like to ask Mommy Adegoke once again, what are some common misconceptions or myths that you've seen as a midwife and you feel like some of these things tend to affect children later in life?
Thank you. Common misconceptions. A number of them. There are several. Let me just say this. For instance, this is our normal moral reflex. When a baby hears a bang or anything that startles them, so you see them fan out, raise their hands, fan out, and from there, some babies may cry. And at the end of the day, our mothers believe that the baby is being frightened with something. And the next thing is to go and prepare incision on the baby's face, on the baby's legs, the back of the buttocks, their main back, and the back of the palm. Don't believe that when your baby is doing that, the next thing is to keep throwing the baby up. And they keep throwing the baby up, turning the baby's head upside down so that the baby can be bold and confident. That is their own rationale. Meanwhile, in a way, they are causing problem in the baby's brain. Their brain is still very succulent. The whole entire skull is still very fragile, but they are ready to do all sorts on the baby's head, on that innocent skull. Just because the baby looks a bit startled. And it is normal. It's a normal response. So there's always misconstruction. Okay, they always misconstrue that aspect and believe that when you turn your baby upside down, or you go to massage their head, or you always ensure that you throw them up whenever you bathe for them in the morning, baby will be better, which is a big fat lie.
Thank you, Mommy, for that. And I picked something from that I want to talk about. It is that it's just like as an adult, if you step on a hot iron, what would your body do? Immediately you would refrain. You would take your legs out. Same with these babies, they have reflexes that when they are being born, it is just part of their reflexes. They have different kind of reflexes. It's okay that babies start to, it's okay that they feel a bit frightened, but it doesn't mean that they are scared. It doesn't mean that they are afraid. And it doesn't mean that until you now begin to throw that baby up, that is when that baby will be a bold person in life. No, it doesn't have anything to do with that. I used to say something. Can we compare ourselves sometimes with the whites? You can never see whites believe that I need to throw my baby up for my baby to be brave. So it means that it's not necessary. We don't need to believe in that concept. It is a misconception. Thank you, Mommy, for that overall explanation. Okay. over to our pediatric nurse. We used to have people say when you give birth to your newborn, you need to have different medications, prepared for them. Like the common one that I've always seen people use as a result of probably their children have jaundice and all of that is, this, spamine in court, and then they tell you, oh, it works well for jaundice, and they have vitamin C, they have paracetamol, they have Greek water. I've even seen
Yeah, great
well-educated
water.
individual asking me, please, do I need to buy Greek water? And I'm like, as
Okay.
how? So we see people ask those questions. That means it's still in practice. People still practice it. It might not be as the way our mothers or grandmas practice then, that they buy a bowl specially for it. But we still have people practice it. What do you have to say as a pediatric nurse to that?
Yeah, bowl of drugs. It is well,
Yeah.
oh. I think it's just what people believe, and when you don't give them, they feel you have not done the right thing,
Mm.
because they feel that when a child is born, the child should at least be using multivitamin, be using all sorts. But there's just one thing I'm going to say: breast milk is enough. The child
Mm.
is eating. Why do you need multivitamin? The child is not running fever. Why do you need paracetamol? And peradventure, let's now assume that the child is not eating or the child is running fever. There are various things that can cause it. So it might not even be
Mm.
multivitamin, it might be something else. So my own advice is, instead of having that bucket, see a physician or a pediatrician. At least they will run various tests to be able to know what the cause it what's the cause of what's happening to the child. Because a child not eating can be different things. It's not only
Mm.
because multivitamin is the one that can cure it or anything. No. So my own advice is, you don't need those drugs. When you notice any symptoms in your child, just take the child to the hospital.
Mhm.
Because what will I say? You can do something, you can give the child overdosage. How do you even know the dose of the medication to give that child?
Mhm. Yeah.
And in pediatrics, we don't even deal with age, that 5 months or 6 months is
Yeah.
weight.
With weight.
So how do you even know how to calculate it? Or because they just wrote on the container that for 5 months give two
Mm-hmm.
meals.
So
So
meals.
I had an experience that a child was vomiting, and the
Mm.
mother gave this metoclopramide. And you not
Okay.
believe that the child's tongue came out. That was the first time I saw the adverse reaction of
Ooh.
metoclopramide. Like, I
Yeah.
was scared. The
Jimmy
tongue
baby.
was out. I was like, wow.
Mm.
So because it worked for a baby does not mean it will also work for your child. So the
Mm.
best thing, bring the child to the hospital, let them do their work. So that's what I have to say.
So now you are telling us that we should not get medications for them when they are not sick. Nothing is wrong with them. Breast milk is the best food.
Yes,
Maybe
breast
that
milk
we
is
are
the
still in our
best.
breastfeeding week, our breast feeding week.
Week.
Yes. But what do you have to say to herbs for
Ah.
newborn? Maybe bathing them with herbs, giving them herbs to drink, or using herbs on their cord.
Okay, okay, okay. On the cord, all this using apps, using cow dungs, using
Mm.
hot water, fomigbona or all those things should not be
Mm-hmm.
done on the cord. Even the new research is that let just leave the cord like that.
Yeah. Mm-hmm.
Just bathe the child and leave the cord like that. And some people still believe that, okay, we should use spirit and
Okay.
cotton wool. That is
Mm-hmm.
still very reasonable. Or we should use this gel on it.
Yeah.
Yes, it's still very
Certainly.
reasonable. But using apps on it, using toothpaste, using cow dung, no, it is not, because that umbilical cord infection can pass through it to the baby, and it
Hmm.
might be harmful. Tetanus, we can't say anything. Tetanus, and if you see a child with tetanus, it is a very brutal condition. Tetanus is a very brutal condition in neonates. So all this applying anything should not, in this era, should be
Hmm.
stopped. Then talking about apps for children is very risky. And the major thing is that their organs are not yet developed. So when you
Hmm.
are giving them apps, and these apps, yes, fine. So people said it works and all that, but we don't know the quantity. There's no scientific rationale that, okay, this is the quantity to be given to this child. We don't know the quantity. Fine, it might work, but we don't know the quantity. You're just giving the child. You might be overdose. You might be giving the child overdose, and it can have effect on the kidney or the liver. And that's why you see that these days now people are falling down with kidney issue. It's not everybody that smokes, so it's not everybody that drinks. It might be those apps that they've been taking when they were small that is just having effect on them. So apps on children, please, grandmas, mothers, mother-in-laws, fathers, mothers to be, we should not give our children apps. Breast milk is enough. Do you know that even when a child is having like catarrh or cough, some people believe that you should just give breast milk to them and it
I
will
believe in
go.
that, honestly. I
Yes,
see
that you
breast
don't
milk
have to
as a
give them
medication.
anything, any medication. Just breastfeed them. Just continue breast. As far as the child is taking breast milk, just continue breastfeeding and the flu will go. So I feel for now, a child under 6 months should just be exclusively breastfed. That's my take on
Thank
it.
you. Thank you for that. I would like to ask our midwife in the house some questions as regards some of these myths that has been associated with newborn and what it can cause. In a situation whereby a child has jaundice, I've seen mothers say use apply breast milk on the eyes. Jaundice will go. What do you have to say to this, mommy? Yes, because I've seen people practice that.
Okay.
Breast milk in the eyes, or even some people, mommy, some people go as far as using toothpaste on the cord. What can
Yeah,
this result to in the child later on?
thank you very much. Sorry, don't say I'm trying to take you back from
No,
the
at all.
discussion my sister just, our pediatrician just, had now. I always say this to women that if they know the size of their newborn stomach at birth, they will never allow anyone to put anything in the baby's mouth
Their babies.
except for the food, which is the breast milk. But because they don't know the size of the newborn stomach, they want to put everything, different
In
form of
their mouth.
concussion, different form of unprescribed drug, and the breast milk. At the end of the day, when we do our growth monitoring, we notice that baby is not growing well because the stomach is being occupied with a number of junks,
Thank
rubbish
you.
as well. So when it comes to
Amen.
jaundice, when it comes to
It is
jaundice,
truly well, honestly. Because when you see
people
some results at the end of the day, when a child is 5 years old, 6 years old, and begins
like
to ask some questions about when they gave birth, you really
my
feel sorry for them.
that is even if they do not increase the mortality rate at birth. Oh,
And that's if they
whenever
say
we
the
talk
truth.
about concussion, there's a scenario that always comes to my understanding. I said this with some of my pregnant women last week because I can never recover. I've not recovered from that incident to date. And it happened around 2019, 2020. A newborn, they rushed the baby into our emergency, and by the time the mother was crying outside, please, can I go on to explain it? Hope I'm
Yes,
not
ma'am.
taking time.
At
The
all.
mother was crying outside. The mother-in-law rushed, followed us down to the place where we were taking care of the baby. As we started functioning, a less than
Content.
2 days old baby, less than 48 hours, as we were suctioning, I wish I snapped that what we suctioned out. Come on, over 1,000 liters.
What?
As it was coming out, we're like, I just faced the grandmother, the grandmother that was there. I just faced her and I asked, I said in my local language, I said, Mama, you are going that grandma, which type of concussion did you give? I didn't say did you give concussion. I said, what type? I want to know the type. The next answer was Agbova, malaria concussion for a less than 48 hours old baby.
Baby.
The thing went to the baby's lungs and that was it. We lost the baby in less than 1 hour of getting to the hospital. In fact, the whole thing was just from the nose from everywhere. I got furious. Oh God. I just tried to be professional. That was why I didn't say anything again. And I just left the scenario because what's the sense of those waste? Preventable conditions, can we just prevent? Avoidable deaths, can we just avoid them and prevent? So that is mortality. Oh. How much more the ones that the problem will not be now is later. The mobility rate is high. It's later in life that we begin to bear the consequence. And these are innocent babies. I always tell them, if you know try to know if you know the size of your baby. At times I demonstrate it during the classes. This is your baby's stomach size at birth. This is the size at 1 week. This is the size at 2 weeks, so that they will know and have better understanding. Is there. So the jaundice thing we keep teaching and telling them. Jaundice treatment is not whatever method except for phototherapy. It
Yeah.
depends on the level of bilirubin. When we do for there are some we do for therapy immediately. There are some we need to do EBT, exchange blood transfusion, to remove
Transfusion.
the blood for the baby in the newborn before we even continue with phototherapy.
Therapy.
Yeah, if the bilirubin level gets so high, it will cross the brain barrier and go to irritate the brain cells. At the end of the day, by the time your baby is supposed to be, passing through some developmental milestone,
Milestone.
baby neck
Yeah.
supposed to stay, baby is supposed to sit up, baby is supposed to start crawling and all those things become difficult. And by the way, there's one of our patients some years back. You know what the patient said? That the patient baby was turning yellow. It was so evident, so high. And the baby said, I'm not going to say it. So the baby said, because it happened to be a Christian, that is the blood of Jesus that covered the baby.
Oh.
That's why baby was yellow. Can you beat that?
Wow.
They put in religion. I don't know. At times, they make medical practitioners feel as if they don't know God. We still need to be professional to teach the right thing. Eventually, they decided themselves against medical advice. And that was it. By the 6th day, they brushed the baby down.
Imagine.
Baby completely turned yellow, epistaxis. Blood was coming out from the nose, blood was coming out from the mouth. They said baby stopped breastfeeding. And that was how the baby went back to where it came from. It was necessary. It was unavoidable. I'm telling you, it wasn't necessary. It wasn't worth it. But the truth is, in fact, that woman, immediately it happened, in my mind, I was just thanking God for her. Because if that baby had made it, that baby would have been a vegetable. They won't be able to come. But times when we say this, when we keep teaching it, we keep creating the awareness. Some people will hear, some will not hear. The man, so long, maybe not learn lessons from our own case. I'm telling you, from our own mistakes and all. We shouldn't make any, especially for the first timer. Remember for more practical. Don't make your own first child as a specimen. Listen, the baby is not litmus paper. Don't use to test what is not and cause unnecessary problem for the baby or even for yourself in the nearest future. And the future is almost here.
Yeah.
Israel.
The future is even here because I know that some of us are already getting married and we still have these grandmothers who believe, solely on some of these myths, and we just need to be well educated to be able to tell them and stand our ground that no. Thank you, Mommy, for that explanation. I would be throwing this question on this Yoruba saying of Okaori because I remember writing about it too, and I had a lot. In fact, from learned individual that Okari is real and it's true and it's killed so person and it's killed so child. And then I will throw it first to a pediatric nurse. Can you tell us a bit about the fontanelles? One, and how do we come up with that Okaori? And I'll throw it back to Mommy. What should be done when a child has that Okaori? So we're able to know whether it is true or it is false, or maybe that was what really killed those children. Because you see, under that comment, I had 3-4 people saying it is what killed my mommy's daughter. It is, and I'm like, how? So tell us a bit about the fontanelle, and then we'll go back to Oladegoke.
Okay, thank you. Let's know that fontanelles are in children. Every child must have it. And you either have the anterior, the one in front, or the one at the back. So and let's know that those fontanelles closes by itself. That's how God made it. But there are some times that it is always visible. And I'll tell you instances where they are visible. Number one, the instances where a child is dehydrated. You can see very well. So you'll be able, that's why they'll be thinking that only a calorie. Maybe the child is dehydrated. So that is what made it visible. And they feel that because he's breathing. So we should be applying anointing oil to it and all that to it. But I just want to tell mothers today that it will close up by itself. Whether you apply anything or you don't apply, that is how God created it. It will close up. So there's nothing like or cowrie, or it is not a disease. Let me put it that way. It is just a physiological way the Lord has created every one of us, and every one of us too has it. It's closed by itself. So let's know that there's nothing like Okaori. Let's just debunk that myth today. There's nothing like Okaori. It is just a frontal that it will close by itself. I even as when I heard that this week, a mother still said that ọmọ yìí ní ọkà and everybody was laughing, was like kí lẹ́yìn mean ní pé ọkà when a child is dehydrated or a child that does not grow well, failure to thrive too,
Yeah.
it becomes
And
very
that's why it's when the
obvious.
child who is
Something,
malnourished.
yes, malnourished, yes. So it becomes very obvious. So there's nothing like that. It will close by itself. That is how God created it.
So
So
what do you
that's
have to
just
say
my.
when our mothers or our grandmothers or even the public says that you need to cover that place? In Yoruba they say majakategun festi. People do that. People say
Yeah,
that, right?
sure, sure,
So
sure, sure.
does the weather have impact on the fontanelles?
Ah, weather does not have impact, but the only thing I would just say is that dress your child according to the weather. If the weather is cold, definitely wear cap for the child. And if the weather is hot, you see some children, they'll be sweating profusely.
And the
And then mother
mothers
will be like,
still wear
no,
cardigan.
omo. Because if you
Eh,
check the
eh.
temperature of that child, it might be very high. So
Mm.
I tell mothers, dress your child according to the weather. If you see the weather is cold, dress the child. If the weather is a little bit hot, try to loosen up the clothing and make the child feel comfortable. Because even when there's heat as an adult, you'll be sweating and you'll not be so the same as children. That's why you see them, they'll be crying profusely and you'll be like, omo, or child does not know it. So
Mm.
let them just dress their children according to the weather. So that's my
Thank you
say.
so much. Over to mommy. Mommy, people said that okaori, in Yoruba, the frontal, that spot between the head of a newborn. Majorly people see the frontal one. People don't even know about the
Yes, at the back.
anterior one. People
Yes.
know very well about the anterior one because it's the bigger size and it's very obvious. And people said he killed so person, killed so baby. Do you believe in that? And what do you have to say to it?
God forbid, how could I believe in that? God have mercy, I normally, it's true. In my place of work, my patients know. We always show them the baby's head. And that's the fontanelles in Yoruba land, they call it awuje.
Awuje.
Ajẹkọ̀rẹ́pẹ́ to them, méjì gan ló wà. Ìpè táwọn ní láti mọ̀. The mothers need to know. There's one at the front, there's one at the back. I always tell them, the one at the front, no matter what you do, because I always tell them, all the oil that you're supposed to use to fry plantain at home, you put everything on the baby's head in the name of a particular place not getting dry. You don't stop wasting your oil. The one in front will not grow up until the baby is between 18 months to 24 months old. I always say
Yes.
something. The one at the back, no matter what you do, we don't close up until about 6 weeks to 8 weeks, thereabout average.
Yes.
So all these things we make them to understand. Even some that do not know that those depressions are actually there. I always say that for Muslims, they will shave the baby's head before naming,
Mm.
declaring. We
According to
always say
the
to them
for
that
the
for
head.
babies that do not have much hair on the hair, it will be visible. You
Obvious.
easily see them.
Yes.
It will be obvious to them. So in a nutshell, even the baby care of baby said, just put your oil generally, rub it round, comb. Stop concentrating on a particular
Size
Cowrie.
of
conga
the
níbi
head.
kan, kò sí nǹkan kan tó máa ṣe sí. So they're actually in two ways in which some people explain it. Some people refer to that awuje, that fontanel, as the okaori thing, the space between. And some people refer to it as there are some vessels. If you shave the baby's head, you may see some tiny, tiny vessels. And we made them to realize that every part from head to toe has its own blood vessel.
Blood vessels.
Totally, every part of the body. So we encourage them that they should learn to give the baby food as at when necessary. Between 2 to 3 hours, you want to rock a newborn up to feed them. You want to rock them up. It shouldn't exceed 4 hours before a newborn will eat. But
Another
for mothers, they are happy. Immediately grandma backs baby, they are like, grandma, God bless you.
Olúwa ṣeun.
all this one.
Baby will not come back until evening. Baby will not come back until 6 hours. And for such babies that are packed for 2 long hours, gradually, the baby will be telling on the baby side because baby not grow well, because baby is not feeding as at when necessary.
Mm.
So bí wọ́n ṣe lè fi pípọ̀ kó bá ọmọ tún nìyẹn o. That's why I can use prolonged backing to to affect the baby. So if the baby is not eating well, not well nourished, and all the rest, all the space will be prominent. I will be referring to it as a okaori. Then we will explain to them that those junctions, because of course on the baby skull, there are a number of bones that come together to form the skull. And
Yes.
each of them has its own sutures. It is the junction between where they join, where the bones join. So during the labor, during vaginal delivery, if those junctions are not there, because there's little manipulation that happens and the baby passes through the pathway. So by the time you're push as you're pushing out your baby, there are little manipulation that happens on the baby's head. So when the baby comes out on its own, without any midwife's interference, the skull gradually return to the normal shape while inside the uterus. It's only babies that are born abdominally that will not have that little alteration. Except if the indication for cesarean section was prolonged labor, that the baby's head had already got stopped inside the pelvic bone.
Yes.
But if it is the latest cesarean section, you will pick the baby out, the baby's head remains the way it was in the uterus. But for vaginal delivery, especially in prolonged second stage, the baby comes out,
and it doesn't mean that the child health will not be normal again, because some people believe that it will not come round again.
It's not so. In fact, the midwife would not need to touch the head. You know what I always tell my pregnant women? I said, if they have the opportunity, immediately the baby comes out, they should snap the baby. They should not snap the baby's head. Because we do early initiation of breastfeeding. We deliver the baby on their chest. So that they can put the baby to breast immediately. So right there, I told them, you make sure you snap the baby's head or just look at the baby's head as the baby is on your chest. After some hours, look at the baby's head again. The following day, look at the baby's head again. You will see that there are differences between the baby's head you are seeing the second day to what you saw immediately the baby was out. On its own, it will return to the normal size. That is why we always discourage it. Don't massage their head. You don't need it. So all this way we've been teaching it, we'll keep teaching it. But there's nothing like that. As a matter of fact, there is nothing like that. I've seen patients brought their babies back to the hospital. They wanted to see me because they wanted to show me that skull. I just said, relax. Make sure your baby is eating well. Don't avoid prolonged backing. Feed the baby exclusively, and you'll be good. By the time she came back for another immunization, she was already smiling. I told her, no, there's no cause for alarm. But if the baby is malnourished, everything will tell on the baby. You be almost seeing the head. Especially if the baby does not have much hair, or if you have bad hair, actually, you'll be able to see it very well.
Very well. Thank you so much to our guest. And for viewers at home, if you have questions, kindly drop them in the comment section. I can see someone said earlier that people believe that on okra, is high in potassium level. Whatever nutrient is in okra, the best thing we all need to know is that okra is good. It doesn't mean that pregnant women cannot take okra. Even our children, in as much as they are 6 months and above, they can eat any homemade meal, like any homemade meal of choice. You can give them to have a taste, and you're able to pick what they like. So if people say, don't give that child okra, the child will be drooling, you should be able to educate them that it doesn't matter, they can eat any food of choice. Thank you to every one of us online at the moment. Okay, so now to our guest, I'd like to ask Mommy Adegoke, febrile convulsion. The thing people do is to put metal spoon in the mouth of whether it's a very grown-up child, maybe a toddler or an infant or whatever. So do you think this stops febrile convulsion? What should be done when a child is having febrile convulsion?
They're just enjoying a baby's mouth. You don't need to insert anything in the baby's mouth. In fact, that can injure them the more. In fact, some put solutions. Some put agbo. They just want the baby to swallow. In fact, that would be the thing to kill the baby first, because baby will easily aspirate.
That's it.
So before they even get to the hospital, that febrile convulsion, whatever is causing the convulsion, whatever is causing the fever, that one will not eventually kill them. But some put onions. They cut
I've seen
onions.
that onions before. I think
Thank
I
you.
wrote about it when I was much younger. Sorry to cut you. My
Thank
brother
you.
had convulsion. The only thing he used to show up is malaria is to convulse. And I remember in particular the thing that brought him back was that onions. But when I got into pediatric nursing and then I understood what febrile convulsion is, I'm like, what happened then? Onions worked that time. So what do you have to tell us? Yes,
That
what do
is
you have to tell us about onions and
based on what
convulsion?
you just said, Nana Sakere, based on what you just said, that is what most people will say. They will be like, it's
Yes,
been
it
working.
works.
It's
Yes.
what? We use it to
They
revive
do
so
know
and
that.
so. Meanwhile, it's just God that had mercy on them.
Mm.
It
And
could
I'll
have been
say that
another
the
story.
exposure, by the time you carry that child, you already exposed the child to fresh air and all of that. The temperature is crashing down.
Telling you. So it's not about this. So we need to let them know the rationale, the reasons
Mm.
behind what we do and what we are
What
asking
will
them
you
not
do?
to do.
Mm.
And this is one of the ways in which you can actually hear, because all these things, something you are used to, something you grew up with,
Mm-hmm. To
and
know.
somebody when you are now in your 30s, in your 20s, in your late 40s, our mamas in 50s, and somebody,
Mm.
one young girl that is just joining nursing profession now comes up. ọmọ tí ó sì gbẹ́gbà tá a fi ná sí 20
Ebi bá
children
ṣe tọ́nu.
gbé báyìí tó ẹ
Ìtumọ̀ bàbá
nìyẹn
bẹ́ẹ̀ nìyẹn.
ló bá ti rọ́kọ láyé. Those things. So
Yeah.
for you to not come up to this is what I say, because in my antenatal we encourage the support persons to come to the clinic with them, then their husband, mother-in-law, big auntie. So most of the time, it's even the mother-in-laws that ask me this question during antenatal. I'm telling you, and I appreciate it because it makes them more knowledgeable. We tell them the reasons why we ask them not to do so, and so. So when you have a child with that, putting anything in the baby's mouth is a no.
Hmm.
Just ensure that you can just help them to ensure that their tongue is not in between the teeth.
Yeah, so
That
they
is
don't
all.
bite it.
So that they don't bite it. Expose
Mm-hmm.
them. You want to expose them as much as possible. Any tight clothing around, anything dangerous around, you want to ensure that the environment is calm. But my own take is that I don't even want your baby to have febrile convulsion.
Convulsion.
I don't even want it.
Mm.
I don't. So I love the preventive aspect. What can we do to ensure that baby does not? So we always said that babies, newborns, and our babies and fever, they are not friends. So their own brain
Mm-hmm.
cannot control
Yeah.
fever. Their hypothalamus is not yet mature to control fever. So
Yes.
so all those things, and we always try to educate mothers that you can easily pick it if your baby is about having fever.
Mm-hmm.
When the
Mm-hmm.
baby grabs your nipple, when they attach on your areola to suck, you will know if there is increase in their temperature compared to what they used to have. So from there, you want to keep a closer watch to observe very well. Because some babies who will be having fever and no, they'll be hitting, they'll be playing. There are some babies like
Yeah.
that.
Yes, yes,
They'll be
yes.
playing, they'll be hitting so much, and their own gem, who they share. Oh
And
no.
suddenly they start convulsing.
Mother, I always say mothers are nurses. You should be more knowledgeable. You don't need to be a nurse before, because they will nurse the children to maturity. So all mothers are nurses. So you should be able to pick it to know that something is wrong. This baby, no, this temperature has increased. How do you know? I felt it on my breast. You should be able to know when you breastfeed the babies. So we don't even want them to have febrile convulsion. But paraventure they eventually have, you don't put anything in their mouth when convulsing. No. And you want to ensure that you expose them and all, and you make sure that they get to the hospital so that we can know what's causing the convulsion and treat them immediately.
Yeah.
Thank you, mommy. You know what she said? She said, we don't even want them to have febrile convulsion. I remember having a child who convulsed until date had a sequela. A sequela is like the aftermath of the convulsion. Because at the end of the day, the child kind of had like a bit of stiff neck and wasn't able to hear very well any longer. So it is best that a child do not convulse at all than having a child have either one or even more episode of convulsion. I used to advise mothers that we can all use a digital thermometer. We
Yes.
can all learn how to use it. We can have one in the house. You don't need to be a nurse to have a digital thermometer in your house. Have one, learn how to use it. A temperature, if you have a newborn less than a month, it is okay to have their temperature between 37.5, 36.5 to 37.5. Anything above 37.5, be very, very vigilant. The question is, how do I use a digital thermometer? You just switch it on, wait till it shows you LO, put it on the heartbeat of the newborn, and wait till it gives that sound. It is not hard to use.
Simple.
So anything you get above 37.5 for your newborn, please go to the hospital. I tell mothers, it's better you get to the hospital and they say, madam, kí ló wá le tó bẹ́ẹ̀, kò sí nǹkan tó ṣe. Now you get to the hospital and they say, kí ló dé tẹ́ ìgbé wá lánàá. The difference is serious. So I advise mothers, you can get water thermometer at home. And what do you do when your child is running fever? Expose that child to fresh air. That is one thing you can always do. Give that child breast milk. If it's still like 37.6, you want to watch, right? Watch for the next 12 hours. If there is nothing coming down with that temperature, please go to the hospital. And don't just go to the hospital whereby you don't even know if who you are seeing is a medical doctor or if who you are seeing is a quack nurse. Please go to standard hospital where you can see a pediatrician or you can see nurses. And that is what I have to say about that. Thank you so much for that, mommy. We have a question in the inbox, and I would like to put it out before we go on. This person says that Adefara Toluwashefumi, thank you for joining. He or she said that, what can you say about babies swallow hair from the womb and they blow it out from the navel when the baby was born? She says, what I'm trying to say is that omoja irun eje ninu oyun, something like that. I've never heard of this before. I'm just reading this. Whatever. So back to Mommy Adegoke, I know that.
Exactly. Mommy Adegoke will be the one to answer.
Okay, over to you. I don't know if you've heard of something like that where omoja irun eje ninu oyun and
Yes, please. Àìmọye wọn lọmọ járun jẹ nínú. Yes, so. But let me tell them pé kò sí irun kankan tán kó sínú. What the baby will take in they will swallow their saliva and their amniotic fluid. They wee inside the amniotic fluid. They really they jiggle, they thumbs up, they kick up. All those ones are the things they will do inside. Whatever, I always say this to mothers, whatever your baby is presenting with as a management, as a treatment that goes along with it, do not keep quiet, do not assume anything and stay back at home. But you know the problem of most of our African mothers is common with us. You will see people that have never been married. And they are not maybe in medical line, they've never been married. Talk more of being pregnant or having children or raising children. You will see them cancel. They will cancel all others that are not seeing mothers. Why? When they get the things to cancel with, it's just what they grow up to know. The culture, the tradition, the norms, how we do things. And the truth is, I cannot want to make my hair now and go to my mechanic. It's not done. If I want to make my clothes, I will go to my fashion designer. But in African setting, we just take cancer from whoever, wherever, any day, anytime, and we go with it. Please, whenever you feel your baby is presenting, whatever sign your baby is showing, please, it has its management. Same thing, I always lay the emphasis when it comes to teaching. When people start talking about teaching,
another
topic on completely. I say I want recently. We almost lost that baby. I'm talking about something that happened just 2 days ago. You know what took me seriously? By the time they brought the baby, a baby of about 6-7 months, 16% PCD.
Imagine.
Yeah, the blood pressure was already almost convulsing. We need oxygen was needed, transfusion was needed, this and that. I was like, why would you wait till this baby deteriorate this much? By the time I took my history and she told me the duration the baby has been feeling sick and all, they kept saying they told her it was teething. Okay, there's something like that. But okay, paraventure there is something like that. So if your baby is vomiting, if your baby is having serious fever, if your baby is stooling, does it mean that I should watch the baby till the baby cool to death? In the name of cutting teeth? There is a way out. There's management, there's treatment for it. Ask the right person. But we don't tend to ask the right person in the African setting. God have mercy on us.
Amen.
Amen. when we are sick, we don't go and see doctors. We prefer to go elsewhere. And that will take us to another question here. I would like to ask our midwife. We often have pregnant women go to churches to register. Some of them even practice. They come to antenatal. Then they have churches where they register. Okay,
baby.
and but by the time they want to give birth to their children, they go and give birth in the church. Now, I would cite this scenario before I have mommy talk about this. I remember about 2 years ago, this was a newborn of 14-day-old. We lost a 14-day-old precious baby, because this parent they are waiting, a waiting parent.
Yeah.
And this woman, she booked in the hospital as well as in the mission house. When she wanted to deliver, she delivered in the mission house. Okay, fine. And then after delivery, they wanted to do circumcision for the newborn, not knowing this newborn has hemorrhagic disease of a newborn. I don't know that me and mommy, what this can cause in our newborn babies. Hemorrhagic disease of the newborn is when you cannot know unless you have a cut on your baby. When the bleed on that cut does not stop, that's when you've entered problem. And now this baby has a blood group that was so scarce, and we eventually lost
negative.
Now, yes, and we eventually, for over 12 hours, we couldn't get the blood. We went to almost all the blood banks in Ibadan. I cannot forget that night, and we couldn't get anything to save the life of this newborn. And why? Because the grandmother said, that can help out to do circumcision of this newborn. And then they went there. They did the circumcision around 9 a.m. that morning, and the baby started bleeding from the penis from 9 a.m. to 7 p.m. the same day. The mother did not come to the hospital. They went to the hospital around 7, and then we started running around, but it was late. Now, what am I trying to say is, what do you have to say to people who register in churches? How does this affect our children, the newborn, even adult children? What do you have to say to this? We are Christians here, so don't think I'm a child of God. I believe in God, and I know those that are here too are children of God. They also believe in God, but we're talking as professionals to us. So what do we say about mission delivery in mission houses?
Thank you. Can I bust your bubble?
Yes,
I'm sorry, I don't know how to mince words. My mother is an baby. No, she was once a teacher. Okay. Before she had that calling to go into that. So she left government work after 10 years. But she's learned, number one. Number two, she started as voluntary worker under the church. Then she went for training. In fact, I've known about nursing, I've known about deliveries and all before I even went to nursing school at all. Now, how do we balance? The truth is, my sisters, we cannot eradicate them.
So we can't take them out.
Instead, we want to deceive ourselves. Me, I don't know how to deceive. Let's be sincere. In fact, the government had known that. I know some years ago, they started a particular training for all those voluntary workers and all. Because the truth is, whether you like it or not, hospital. Some people will not step there. They will go to the grassroots level. First contact. Their mamas that will pray for them. Their mamas still hospital. Their mamas, I'm telling you, I don't want to go to that. There are several factors surrounding that. Anyway, let me know. It's another topic for another day. But let's leave that. Back to this. Our patients, these patients we're talking about, let them know the reason, the rationale behind everything. Hope you know that till date, there are several babies. But hope you know that today there are several babies. They dare not use injection. Hope you know that. I know what I'm saying. They dare not use many medication. If they use it, they are working against the policy of that faith home that they are working with. So some of them, if they need to save a woman's life, maybe they need to do a particular drug after delivery, maybe the woman is bleeding or whatever. In fact, they will want the woman never to say it out. And they will now, I'm not talking from, sorry, what I've seen, what I've, is not, what I have online information on this. Of course, my mother will not do that because she is learned. She went for more training and she has a relation with big hospitals which will attend to her emergencies. Are you get what I'm saying? But it
Yes,
does
ma'am.
not applicable in all cases. So people will want to, several people will still go there. Learned people, they will go there. Good. But the truth is, when mothers are knowledgeable, my mother had called me before and she said she has a patient, a woman with multiple gestation, previous car, she was
Ah,
hypertensive, her PCV was low.
Imagine
She
in a
came, she said,
vision out.
mommy said, Odo mi kọ́ ló bímọ sí,
Ah,
that you
Holy
are not going
Father.
to deliver with me. I said, mommy, no, I will deliver with you. Ọlọ́run yóò ṣe, wọ́n ní yes, Ọlọ́run mi ẹ̀ ṣẹ̀ṣẹ̀ kú ṣe, Ọlọ́run mi ó ṣe, I believe. I have faith. But má fi wèrè fún Ọlọ́run mi lẹ́jọ́. You understand that statement?
Mm-hmm.
So she would not write the referral letter. She had called me on several occasions that I've sent some patients, oh, blah, 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 blah. She's adamant. She said she would not come. In fact, there are some she had referred them, they did not show up in the hospital. They said at night when they got to her place, say, oh yeah, hospital. She did not even allow them to wait because she is knowledgeable. But the patient, because they are ignorant. So there is power in knowledge, my dear. You have two scars. You have done myectomy. You have done two cesarean section. You went to faith home. That is a disbelief home. Sorry to say. That's no longer
one
a faith home.
miracle.
That is not
One God
I'm
cannot.
the follow lecture. Let's balance this situation. Let's balance it. There's no wisdom in that. Your PCV is so low. You have some comorbidities. Yes, you went under. Let's even not go too far. You went to book on Innate Center. Is that the thing?
That's
CDA.
another
You have
one.
serious comorbidities. You want to no now. No, we need to but even there are some hospitals that they should not take them.
Yeah.
With some comorbidity when they know that they don't have the you may know what to do, but when you don't have the gadgets to do it, when you don't have the necessary thing to do, are you get what I'm saying? I cannot
Yes,
do a
ma'am.
particular procedure now. But when I don't have the necessary gadget to do the procedure in my facility, I should be able to do the right referral. So it's even beyond CBAs alone. They will be not sitting now. Some people will be like, hey, now see come belek belewa, there's a nurse
Yes, sir.
in our neighborhood. They know if you call me for such, I will give you quick referral. You don't even block my job with so because that is at the end of the day, it will people will not know that you're trying to help them. When
Yes, sir.
the thing will turn around. So the truth of the matter is that people will still patronize them. But if our people can be knowledgeable enough, I've seen
know
patients in
when
the
to
hospital,
refer.
they will go there, they will go for prayers, they will come to the hospital for clinic. They will do their test,
Yes.
run their test, they will go for prayers, they will come to the hospital for clinic. And when it's time for their surgery, they come to the hospital. They will not go and waste their lives there. Are you getting what I'm saying? So we need
Yes,
Yes,
to
ma'am.
ma'am.
balance. There are several factors surrounding this place. But the truth is, forget it. You can't eradicate them.
Sure. Thank you, Ma, for that. We often have people talk about stretch mark, and stretch mark during pregnancy can cause deformity in children. Is that true?
Ah,
Yeah. Yes, and some of we are laughing about it because we are well knowledgeable about it.
Yes.
But when you hear some things, you are like, how now? How is that
Asao.
possible?
Am I to talk? Am I to respond?
Yes,
Yes,
ma.
ma, it's
Yes,
you,
ma.
ma.
Thank you. Mothers can have stretch mark. In fact, on the abdomen, they will have it. Some will have it on the breast.
The breast.
Some will still have it near the armpit.
Mm.
Yeah. There's something called striate gravidarum.
Yeah.
There's this line that becomes thickened, the straight line from their
Pregnancy.
navel to their pubic area that becomes more darkened and more visible during pregnancy. My sister, knowledge is power. Every antenatal clinic, they should take time to teach. One of the things you don't joke with in my whole place of no. You must not miss your class because it even makes you more knowledgeable. You know why this is there. You are at peace because you know that nobody can brainwash you and toss you to and fro. You can have it. In fact, expect it. If you don't have it, thank God for your life. I've attended to a woman before for the fourth child, and there was no stretch mark on the abdomen. Smooth stomach, very smooth. I'm telling you. And There are some, even the first child, the whole thing will come out. It does
Mm-hmm.
not affect your baby. It's just in a response to enlargement that is going on your skin and all pregnancy hormones and everything. That is why at some point in pregnancy you can hitch on your abdomen, you can
Mm.
hit on your breast. There's no problem. Oh, can you wear it? You are fine. It's just normal response as you the response to pregnancy hormones as your tummy enlarges and the rest. So there is no cause for alarm. The stretch mark on your body does not affect your baby.
They, hmm. Thank you so much, mommy, for that. I just want to add to that because sometimes during pregnancy comes with a lot of things, and some mothers, because they are so, how do I put it, so careful with their skin. You feel like, oh, I'm getting dark in this aspect. They start using some oil, some creams to get lighting and all of that. This is just a caution to mothers because some of these skincare routine can affect the inborn, the unborn baby, sorry, the baby in utero. So please, for people that do all the skincare routines, you need to speak to your doctor to know what is acceptable for you while you carry your baby in the womb. Thank you, mommy, for that. I'd like to welcome all of our viewers just joining us. In case you have questions, please drop them in the comment sections. I'll be reading through while I give it back to our guests to answer them. Thank you, everyone. All right, so back to you, nurse Odeyemi. So far in your practice, you've heard of different myths, different misconceptions, but has any of this misconception in a way, does it have a positive benefit or outcome? I don't know if you can hear me. I don't know if you can hear me.
I can
Hello.
hear you. Yes, I can
Okay.
hear you.
So
Ah,
does any of this misconception, probably at the end of the day, you're like, no, this is a misconception, but what should make sense? No.
you know me, I'm still a small picking.
We know.
I've actually not seen. I've actually not seen. But the only one I see is to feel that sometimes that you need that make sense. So it's that sunlight thing.
Is what?
Even when not putting a child on that sunlight,
Okay.
even when it does not make any sense.
And different. Okay.
It doesn't make
Oh.
any difference to me putting the child
Mm.
under sunlight or no sunlight. So to me, actually, to be sincere, I've not seen, but they might have been. But me, I've not seen any meat that is actually okay, will make sense or anything, Sha.
Okay. Do
So
you
to
see a
me,
need to to educate fathers and the extended family in the care of their newborn?
yes,
Hmm.
yes, we actually
So tell
see a
us.
need because okay, let me use a scenario. We admitted a child, blah 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 blah, and the father was like, in their family, they have one oyole they used to
Okay.
do, and so they want the child to be discharged. And we're
Okay. They
like,
want to
okay,
go.
this child is not yet fit for discharge,
Hmm.
but they insisted that it's their culture. We spoke to them, psychological support, explained everything, but they still insisted that it is what they do in their family. So what we just did was to just tell them the adverse effect of what they want to do. Your child is
Mm-hmm.
not yet fine, but you said you want to go.
Go.
This is the so complications. Are you fine by it? They said yes. They said, okay, write a note that okay, oh, you are fine by it. So I'll just put it this way that educating fathers and extended family is very important because there's sometimes that the mother knows what to do, but
Hmm.
because
The parent, the father. Hmm.
my husband said, okay, I had a case of jaundice. The mother brought the child herself and she was ready to be admitted. But the father insisted that no, I want the child
To stay back. Hmm.
to go.
Hmm. I think our
And your
network
child,
is okay. Fine.
the father claimed that oh,
I don't know if it's my own network or her network.
I
I'm
think it's
just, I
out.
can barely hear her.
Same here.
Okay, I guess our network has gone off. While we wait for her to come back, I'll just ask mommy this, that in one way I know you run a brand and that's Health Epiphany. Have you ever probably put up a post, probably in video form, or as a writer?
I think she's coming on.
I'll just remove her, so I don't know why. Okay. Okay. Hello, mommy. Adegoke. I don't know. Can you hear me, ma?
Yes, I can hear you.
Okay. So I'm just saying that, have you probably put up a post that probably people had to come up to tell you, oh no, it is this way, this thing fine is a medical discovery, but we don't want to believe in it. We chose our own way.
Yes, if there's been one like that. I can readily remember now. Yeah, that was when I demonstrated how to push out a baby on a
Hmm.
delivery couch. Both on Facebook and yeah, both on Facebook and TikTok, I got feedbacks like
Hmm.
this position of a thing. Can't I kneel down? Can't I squat? Can't I torpedo?
Hmm.
Can't I do this and that? Can't I somersault? A number of things like that. So
Hmm.
there's somebody again, I think today, maybe today or yesterday, was like, they always say we should not push until they tell us to push.
Hmm.
So I just try to make it clear unto them that for the sake, I explained to them the benefit of lying, being in the autonomy position to push out the baby.
Yes.
It helps your midwife to assess your perineum, the vaginal area easily. We can easily help to guide. We can guide easily and
Hmm.
help to prevent lacerations. We can help to do some maneuvering in order
Hmm.
to aid delivery of the head.
Of
And
the
in
head.
some women, after the baby's head is delivered and registration takes place, when the baby turns the head to a particular side, some
Hmm.
babies will get stuck
Hmm.
in that side.
Yeah.
So we can easily access that place to help deliver the anterior shoulder
Yes.
before we deliver the entire bill. So I explained to them, and I explained to them that the couch I was actually sleeping on is not a regular couch. Is a couch, is an electric one that we can easily adjust. That the woman can
Hmm.
come up in semi-sitting position. It's not
Mm-hmm.
something that will just lie
Instead of
flat on your back.
back.
I just because I have had several feedbacks like that. So
Hmm.
I tried to explain to them why it was done and how that bed could actually be manipulated to help them. And the one that was saying, they always say you should wait till we ask you to push before you push. I explained to
Hmm.
them, yes, when your midwife says you should wait, she was trying to tell you that you should wait for contraction.
Hmm.
If you push without contraction, you are just wasting your strength
Yeah.
because it will have no effect.
Hmm.
So
Mm-hmm.
that's
Mm-hmm. Thank you, mommy, for that. For pregnant mothers watching us today, if you push without having contraction, you will just be stressed out easily. Like you feel tired early in the process. So that is it. Thank you, mommy, for that. If you would be asked to debunk any myth now, what would that be? If you've been asked to say, "Oh, tell me that this belief is a lie about newborn, about their health," what would that be?
okay. Several of them, but let me just say this: yellow cloth does not cause jaundice for a newborn.
Hmm.
So whether the mother
Yes.
wears
Yes.
yellow clothes in pregnancy, I've
Hmm.
had series of them. There was one during my antenatal.
Hmm.
While teaching on jaundice, she just said, "Ma, she had done scan and they saw that it was a baby girl that was coming. Baby
Hmm.
girl has some fanciful, beautiful dresses.
Clothes. Yeah.
You can't compare it to males. Though males are not, they're
Mhm.
not trying to compete, but you can still compare it. This woman, fortunately for her, she went to do shopping with her sister-in-law. She saw one nice gown she wanted to buy for the baby. The
Newborn.
sister-in-law insisted that she mustn't buy it. Why? Because the thing has some touches
Yellow.
of
Yellow.
flowery color like that
Yeah.
with sort of yellow. Oh, dude, she was really hot. That she got to the antenatal
Hmm.
and she was telling us during the clinic. I just smiled. I said it was the ignorance of the sister. I always say them,
Yeah.
I make sure your house is being painted with yellow paint.
Yellow.
Yellow.
After delivery, will you stay put in the
You
hospital
pack
and be
out.
sitting in the hospital forever?
You work out.
Ah, that's right.
You
If your husband
repaint.
has a yellow car and after delivery, will you say, my
Mm.
husband, go, let me take bike. I don't want to put my baby inside your yellow car. It's not possible. So just in fact, in the hospital, there's been one relative that came to greet not a mother that just delivered. She just saw that the cover cloth on the baby's or the cover cloth on the baby's skirt has touch of yellow.
Hmm.
I didn't put mouth because I'd already taught my patient. So I taught them to answer that they know the right thing. That mama was telling her that, didn't you come home? Didn't you come to the hospital with another bedsheet? Remove that one now. Don't you see that it has
Everything
yellow?
is fine.
Jaundice will come to the baby, blah, blah, blah. I was just smiling. So the yellow clothes you wear during delivery or during labor, during
Or doing
pregnancy,
pregnancy.
yellow, because does not cause for a baby. But you can be advised that for the first few days of baby's life, don't wear yellow clothes for them. So
Yes, do
that
that.
when the baby is gradually turning yellow,
They will not
when the
say.
baby is about to develop jaundice, you can easily pick it because by then you would
Notice.
have been at home. You won't be in the hospital,
Yes.
especially for physiological jaundice or
Hmm.
breast milk jaundice. So this is what we normally teach them.
Yes.
So, like I asked Nosodemi the other time, I would also ask you: are there some traditional practices that are helpful and that we can adapt to? You feel, oh, these traditional practices are actually helpful. We can take it from them. Yes, because we know other people don't know. Someone will tell you, "Oh, don't mind these nurses. They are just." I've heard someone tell me that. When did you give birth to you now? You're telling us these things.
Exactly. Oh.
So,
So then that is why I would not, I don't know any traditional practice that we can actually adapt now. Maybe in further research.
mm,
Maybe
mm,
when there's further research, they might do a traditional practice. But for now, I've not seen one that we can actually adapt to. Maybe mommy has seen one, so she can
There are,
Gaga,
tell us.
let me throw it to her.
there are, there are traditional practices that are so beneficial
Mm,
that we can adapt, but there are several that are harmful practices.
mm,
Yeah, but there are some that are really beneficial. There are some of them that are very beneficial that we should continue with.
Mommy,
Yes.
like you can give us one or
Like
two.
what?
Oh, thank you. One of the practices is women gathering to aid
Mm,
another woman that just put to bed.
mm,
We have some tribe, in
Okay.
fact, that do better than Yoruba. I'm telling you, when they give birth, when somebody among them give birth, it
mm,
is turn by turn. They
mm,
make some nice healthy broth. They make
mm,
some nice soup. They make
mm,
some nice
Okay, Omugo.
smoothies. They put these healthy fruits together, and the woman gets to eat, and they are well relaxed. There are some they do some body massage with special
Wow.
healthy herbs on the
mm,
woman. In fact, you will not need
Wow.
paracetamol after delivery. I'm telling
mm.
you, yeah. They rally around.
Wow.
They make turns to go to market. If this particular family goes to market today, another goes tomorrow. They make turns to do laundry. I'm telling you.
Hmm.
In fact, Yoruba has its own. There are this, I've forgotten their name now. When one of them gives birth in the hospital, you will know that one of them has given birth.
Mm.
Turn by turn, healthy soup, healthy broth. I'm telling you that they will bring. And it helps a lot. It will help the woman with her lactation because we
Mm.
want breast milk in the first
Yeah.
6 months.
Mhm.
So there are some practices like that. And some practices like, okay, another one is that ensuring that the mother does not go out in the first 42 days, which
Mm.
is for period.
Yeah, true,
That
true,
is
true.
beautiful.
Life
She
is now
must not,
changing. Now
it
people are now
is a
going out and
taboo.
doing stressful things.
Which
She
42
must not
days?
go out to anywhere, not market, not to fetch water, not to, she must not go out. And
She
it's
must be
healthy for
pampered.
her. She'll be able to be well rested.
Yes, so
Uh-huh.
Hmm. Thank you
Yeah,
for that, mommy.
that's
And
thank you,
honestly, that's
mommy.
it. Because we are now in a generation whereby people don't even know why people are not going out in the first 40 something days of
Mm-hmm.
delivery. People just feel, oh, we do it probably for church purpose, until we take our
Yes.
child to the church.
Happy to
That's
watch out.
why we do it.
Maybe it's
But
there
now
to
we
be
now see that
dedicated.
it's for
It's
pregnant
beyond that.
mothers to be well rested. Even
Yes.
for Islam
The
is expected
child.
that women should rest after the whole process of delivery is a long thing. Honestly, it's a very
Yes.
long process, and mothers need to rest well before
Yeah.
then. I would like to say that how do you feel we can pass knowledge to communities respectfully to help them unlearn some of these false beliefs that can
Yeah.
affect children?
Thank you. We keep in life. I always say this to my patients. In as much as we are still alive, we keep learning,
Mm.
relearning, and unlearning. When you stop learning, you start dying.
Mm.
So how do we go about it? Several ways. We continue to create awareness.
Mm.
Antenatally, please, all antenatal, all antenatal clinics, it's beyond checkups. Please
Mm-hmm.
teach. Please teach. Let them know. One topic after the other, one after the other. Let's teach it. In my
Mm.
place of work, as I said earlier on, in fact, when you come with your husband, you will take a gift.
Mm.
Coming to the
Because
clinic,
we want them involvement. Mm.
every clinic you come with your husband, you will take a gift that will take your picture, will celebrate you.
Mm.
Every clinic you come with your support person, maybe your mother-in-law or whoever is going to take care of you after delivery, you will take a gift. We don't overlook it.
Mm.
I'm telling you. And we do
Mm.
that every clinic. You will see women say, I've told my husband, oh, he will take permission from work. I've told my husband, oh, the next holiday, he must come, he will come to clinic. Because they too want to be celebrated. And we
Mm.
know what we are doing. From all these things, because most harmful practices we talk about is the man that will bail the women out after delivery.
Yeah.
That is
Mm-hmm.
it. I can't face if it's happened to me, my mother now, I can say, mommy, don't do this for my baby. But if it's my mother-in-law, there are ways to hit. There are some mother-in-law that may be, so sensitive to such information. But what's the meaning of this? She mama told you that, she told you and her. With that, the husband can easily speak up for her and say, mommy, I was there when they talked there. They said they shouldn't do this, they shouldn't do that. So we need them so that the husbands can help. We want them to be aware, to have this understanding. So we keep doing this, we will not stop. We will not stop. Then in various settings, religious settings, I always love religious settings in church, mosque, that think about the wellness of their members. They create forum for education, forum for
Mm-hmm.
screening. These are good. It can be in landlord association, it can be in one group activity. Let's keep creating there is power in knowledge, and knowledge is power. That is the truth. Until you open your law.
Then.
Whatever you don't know, no, it's can throw you, can look and throw you away because you don't know that can become detrimental because you are ignorant. And
Mm-hmm.
ignorance will come when it comes to health. The deed will be done.
Mm-hmm.
Uh-huh.
Yes, thank you so much for that, mommy. I just want to add to what she said. We really want men involvement, in pregnancy while their wives are pregnant, when they even give birth to the children. Because a lot of stories these days, you hear couples say, you feel like if you go to antenatals, you would have been told. I think there is one circulating around recently, and people are like, I feel like men don't even know when to start having sex with their wife after delivery.
Mm.
They don't even know what to do and how to do it. So when they go for antenatal, they hear all of these things. They are well educated about it. They are not ignorant about it. And even I feel the Nigerian setting or Africa setting need to start allowing men to be in the theater room to see. Let them be in the delivery room to
Even in the
see the
labor room
process.
too.
Yes, to see
Yes.
what's happening there. This kind of like makes them, well informed
Yeah.
about it, and they know all of the process. They are well knowledgeable about it, and then they also can help educate people. I know we have people of different timber and caliber here today, people that will go back home to educate their community, people that will go back home to educate their
Yes.
family. We've got aunties, we've got sisters who have just put to bed, who have children, and we are hearing one or two things, that we know that this is just a misconception. We can
Yeah.
correct them with the little
Yes.
we've heard today.
And what you are
Lastly,
doing presently is one of it.
yes, thank
Yeah,
you,
Yes.
ma.
it's a very good,
Now,
yeah, it's a very
lastly,
good
I
one.
want to ask Mommy Adegoke before I move to Nozodeyemi. How do you feel mothers can get information, especially for new mothers, mothers with precious baby? Because I realize that mothers who have precious baby, they are always agitated, stressed out, because they want that baby to live. They hear advices from people out there. They don't even know which one to take. So how do they get information? I mean, how do they have access to right information?
Thank you.
Information, sorry.
Just as I said earlier on, when you are sick, you are supposed to get treated in the hospital. When you want to make your hair, you go to your hairdresser. Go to the right channel. Go there. And after delivery, mothers should know that it's not only antenatal that we have. There is something called postnatal clinic. Most mothers don't go for it. Because people with special children, people with precious baby, and every baby is precious. Postnatal clinic is important, but most women don't go. They don't go for it. They are just trying to create the awareness and teach it. If 100 people go to, in fact, even till now, not everybody is going to antenatal. I hope you know that.
Yes.
Yeah. Especially when they have given back to one or two, they think, it is a very wrong thing. They forget that each pregnancy is unique on its own, and each pregnancy is different drama. I experience, I've been experiencing it, I've been giving back since 1914. That is not the story now. So they need to know that it does not end at delivery. There's something called postnatal clinic. There, the all is like resumption of intercourse that you mentioned the other time when we bleeding stop. Because experience has shown me that most of the things that you teach during pregnancy, especially during the late last trimester, from 36 weeks upwards, most women they let me say they absorb 40%. The remaining 50%, they have dropped it in the dustbin. Pregnancy amnesia will do its own, that memory loss. As they are sitting there, they're even tired of the pregnancy. They just want to just let me just give birth. So, postnatal clinic, by the time we are teaching some things, they'll be like, it's true. It says you mentioned it. By the time you are teaching them in postnatal clinic, okay, family planning, this time messes will stop. Low care, you can see low care, you can see discharges, but also period. Okay, this is how it go with breastfeeding. Baby can do like this, can do, they get the right information. This is the period you can start intercourse. This you have been up at this stage. Postnatal, it does not end at antenatal. All mothers know there's something called postnatal clinic. And if you're a CS mom, you're supposed to go for first one at least 2 weeks after. Then after 4 weeks, making the 6th week, you go for another. If it's vaginal delivery, from 4 weeks to 6 weeks, you should attend a postnatal clinic. I've heard of a woman that got pregnant over a month-old baby because she's highly fertile. After 1 month, she ovulated. She didn't know she was ovulating, and another baby comes. And it's a good luck now. Maybe they will do ceremony 2 times in a year in their family. When we do jollof rice in February, come and eat another jollof rice in November. Please go to postnatal clinic and don't waste your time. Don't be stressed out. Some women, that's when they enter postnatal depression. They are not people, they are tired. Everybody is saying this. Big mommy comes, she says this. Another person comes, she says this. So, in fact, to them, psychologically, they feel they are not capable to be a mother. They are confused. Let me stop there. Let me not talk too much.
Thank you so much, ma. I was just asking before I go on to another day, that postnatal clinic is very, very important. Honestly, you would even, especially for mothers who had hypertension in pregnancy, it tells them to monitor their blood pressure. I've seen mothers come down with what do we call it now? Postpartum. What's it called now? I've forgotten that. But yes. And it led to a very severe condition. You see them having feet, they start throwing feet, they start having different.
It starts from postpartum blues, which can start 3 to 4, 5 days after delivery. By this time, under normal circumstances, all things being equal, they would have left the hospital, especially if it is vaginal delivery. From there, if they are not careful, to postpartum depression. If they are not careful, postpartum psychosis. So they won't know this except they should have them postnatal clinic, and they should not hesitate to reach out to their medical practitioners. So when they get back, also when they are noticing anything that is not clear to them. Each pregnancy can be unique on its own. It's not about having the experience of childbirth before. No.
Thank you so much
Amen.
for that, mommy. Thank you so much. Over to you, Nosodemi, before we conclude this section. Okay, I'd like to ask you, if you are asked to debunk one myth about newborn care, what would that be?
It will be that we should not bathe our newborn twice daily
Hmm.
because they did
Mm-hmm.
not go out to work or they did
Yeah.
not go out to farm.
They have not got to.
What they pora mole. Because I
Hmm.
don't actually understand why you are bathing twice daily. Bathe
In
for
fact,
them
I believe
once.
that you should not make them daily safe.
Ah,
It has, yes. From my experience, yeah. You okay for people outside Nigeria or people outside the
mm-hmm.
tropical region, when you are in winter season and you have a newborn and then you want to be bathing that baby daily.
To
That one
me,
is not even the
that one
painful
is even
part. Oh.
small. We teach
The
them.
painful
If you
part,
have small
okay.
for age babies, in fact, you don't
Yes, you
bathe them
clean.
daily.
At all.
Yes, you clean.
Your baby
Pretend.
can be 9 months. When it's small
Mm-hmm.
for age,
They
you
are
don't
small
bathe
for
them.
age. Mm.
You
How much
clean
more the
them.
preacher one? So it is not about if sir on this discussion. I've had a baby that lost a baby on the naming ceremony. In the evening, grandma took the baby, 1 way to shower for the
Yeah.
baby. The baby was the one that went
Omi
to
gbona.
make jollof rice, and the baby was the one that served all the visitors. The baby was the one that went to buy malu. They made yes now. They did second bathing for the baby. That was how the baby aspirated the bathing water.
Ah,
Shit.
Ṣe fẹ́ sọ pé ogun èṣù ni àbí? Ẹ máa já
That's
màdì sí
what.
ìgbàlá. They
ogun
want to say,
èṣù
àwọn
lélẹ́yìí
tá ló pàdé bí kíní, God will have mercy on us.
Ah,
Then I keep thinking, so ló dáná ni, kí lẹ ń wẹ̀ fún lẹ́lẹ́kejì fún? We have
Hmm.
taught you this, but thank God the baby made it because the water actually went to the lung. We started
Mm-hmm.
social health
Aspiration
intervention,
for
but
90s.
thank
Mm-hmm.
God they were so prompt in bringing the baby and the baby eventually made it. If the baby did not make it, please, what would have been their lot?
Their testimony.
What is that?
ah.
I don't understand. And
Cleanliness
I
is
wonder,
next to
I said to mothers,
godliness.
when we teach these sample practices, and some mothers are like, grandma will know herself. And I said, no problem. You are ready to come out to the hospital for treatment.
Repercussion.
Wow.
Exactly.
When the repercussion comes, like the story of the woman, the baby I just said, 48 hours old baby. So who bears the brunt? Stalogy Yaju.
Mm. Mm.
Ló níyà ló máa jẹ kíní tó jó olóhùn jẹ́
Yeah,
kóbìnrin
they
níyà.
look what you
Mothers we need to be just yes. And don't abuse them because you too become mother-in-law one day. You become
Yes.
mother-in-law one day.
Sùúrù.
You too have given birth to a baby boy. So ìwọ náà yọ ọkọ ní ẹjọ́ kan respectfully with
Ìdí
Mm-hmm.
regard,
sùúrù ni.
with
Mhm.
understanding. That is why we've been clamoring for our man to be involved so that they
Yeah.
can even speak for us.
Wow.
I
No.
mean, man, no original man. There's some man that are man baby man. Man.
Hmm.
Shall we say, whatever mommy says, what mommy says,
That's you.
Yeah.
please
Mommy's
do.
boy.
If
I
mommy
want to
says,
tell me. Hmm.
everybody go into the kanga, like that's the kanga, we enter kanga, everybody enter the well. But when you have men that will stand up and say the right thing, it
Mhm.
will help the woman
Yes.
a lot. Okay,
Mm-hmm.
we are
Yes.
the receiving end though. We need to be
Mm.
Yes,
knowledgeable.
so you want
If
to
you
go
had
in
had
for 9 months.
an abortion before or a loss of a child before, you will know who bears the pain the more.
Hmm.
You know what it is to carry pregnancy for 9 months. The days you cannot explain yourself, the days you are weak, you are tired, the days you vomit, you want to vomit all your intestines. So is that what that baby you will not be careless with? Every baby is precious.
Hmm. Hmm.
Yes, so every
What do you
baby is
have to say to people
precious.
who say that you will give birth to a baby boy if you vomit a lot in pregnancy?
Can you imagine? Keep vomiting. Keep on vomiting. It is a myth. It's not true. Okay. Any pregnancy can make you nauseous and vomit.
Mm-hmm.
It's not
Mm-hmm.
about the gender. In fact, there are several of them. In some, if you are 38, 39 weeks, 40 weeks, and you do not fall in labor, they will say the baby is a girl. Baby is trying to take orogun, shibi, obiata, jabe. Baby is starting to take all the cooking utensils. That's why baby is staying longer. It's not true. It's not about
All
that. It's
right.
not about that.
Thank you so much for that, mommy. And if you would ask me
Yeah.
that what mind will I want to debunk, I would say that the mind I want to debunk is that we don't necessarily need to allow our babies to pass through this painful or rigorous stretching, when they are bathing them. You see, when some mothers are bathing babies, God,
Ah,
as in, I'm like, you don't need anything hard on their skin. You need something soft. You only need
Hey.
to just, massage them and let these babies rest. They don't need to cry while you are bathing them. If a baby is crying when you are bathing that baby, then we need to question you as a mother or as a carer, that you are not doing it the right way.
Yeah.
Thank you so much for this, my guest. And also, then, lastly, I would like to ask you, what would you say to a first-time mom who is overwhelmed by advice from people? I don't know if she's still on or her network is off. Hello.
Sorry, I can. Sorry, it was
Okay.
muted. Yes.
Oh,
Yes,
so what do
mommy
you have to
already
say to
said it.
that?
Mommy already said it. Take the right information from the right set of people. That is
Mhm.
just, there's no point being overwhelmed. When you have gone to antenatal, they've told you what to do. You have gone to postnatal, they've told you what to do. If you are still confused of what to do, go back to the hospital and ask them. Don't let
Hmm.
anybody give you this information here. Somebody that has not even, like what mommy said, somebody that has not given birth is giving you information and you are
Hmm.
overwhelmed. Just sieve it. Try to sieve. Don't even argue with people,
Yeah.
because in attempt to argue, is they're saying this one that one, just say okay ma, you're the one that know what you want to do. Just try to sieve the good ones from the bad ones, and that can be gotten when you have gone to your antenatal and you have gone for your postnatal care. So that's what I have to say.
Thank you so much, Mommy Adegoke and Nurse Odeyemi. Thank you so much for gracing this webinar today. Thank you so much for putting a lot of information out there for our mothers, our carers, the public at large, so that we can have healthy babies and so that we can have healthy nation. And so,
Yeah.
in conclusion, to our viewers at home, for those that will be watching later, for those that have watched and have left us here, for those that would rewatch later, I want to say thank you for joining. In case you have any question while watching this video, you can do well to drop them in the comment section. I'll go through them, check through them, and I would ensure to send them to our guests. We can have them once more, or we can just put their answers. They can respond in the comment section to those questions. We'll be happy to have your questions, and let us know if you enjoy this section. If you want us to keep having this probably once in a month, can you put it on the comment section? I'll be glad to hear that. Until our next session, thank you so much everyone for joining.
Thank you.
Bye.
Bye.